Good afternoon. Welcome to today's webinar, providing you a Bluetongue virus update on behalf of the industry. My name is Leah Shanks. I work for AHDB in the Beef and Lamb engagement team, and I will cover your housekeeping before passing over to Gareth Hateley from the British Cattle Veterinary Association, who is your chair for today. So this webinar is being recorded and the link will be circulated within the next 24 hours. Due to the urgency of the content, we will try to circulate this within the next hour or so after the webinar finishes. It will also be uploaded onto YouTube, so you can share that link with whoever you may want to share it with. We have had unprecedented demand for this webinar today with 1,400 people registering and the numbers are going up and up. We will do our best to avoid technical difficulties, but if you encounter any, please use your chat or question function to ask for help, and we will do our best to help you. Unfortunately, if you get kicked out of the webinar or you struggle in any way, just know that that recording is on its way and we'll be with you as soon as possible. So you will hear from our speakers first, who will update you, and then there will be an opportunity to answer some of your questions. Like I said, we have a lot of you joining us today, and it's unlikely we'll get through all of your questions, but please do ask them again in your question box. It's on the top right-hand side of my screen. It looks like a speech bubble with a question mark in. Ask your questions and we will answer them throughout. If there are any questions we don't get round to answering, we will upload the answers onto the Ruminant Health and Welfare website. Please check the FAQ function on that website. Your question may have already been answered, and if not, we will be updating that over the next couple of days. At the end of this webinar, there will be an option to complete a feedback form. We would really appreciate you to complete that feedback form if you have the time. You can give us any constructive criticism you may have, provide any additional questions or topics that might be of interest to you in coming webinars. Just to draw your attention to the resource hub. So the Ruminant Health and Welfare website is your resource hub for anything Bluetongue. Please have a look on there. The QR code and the URL is on screen now. You will find photographs of clinical signs, flyers that you can download and print, FAQs, latest updates, all sorts on that website. So please, for anything on behalf of the industry, have a look on that website. There is also a Bluetongue virus hotline available to you to access between the hours of 9 to 5, powered by AHDB. The number is 024 771 0386. Again, any questions you may have, please give us a call. We will support you wherever we can. The gov.uk website also has a wealth of information and again, the latest updates. Search Bluetongue on gov.uk. And finally, please, if you haven't already, do subscribe to the APHA disease alert system. You can subscribe to receive text alerts or email alerts. And again, you can access this simply by going on Google and typing in APHA disease alerts or looking through gov.uk. Here's the URL to access the APHA disease alerts, or you can just scan the QR code that's on screen now. We wanted to draw your attention to a paper that has been published. It's an in-practice paper. Please scan the QR code and it will take you directly there, or again, type into your search engine in practice, treatment considerations for Bluetongue virus serotype 3 cases in sheep, which goes over those treatment considerations. So some additional reading for you there. And finally, before I pass over to Gareth, just to say again, on the Ruminant Health and Welfare website, there is an information leaflet all about Bluetongue. You can download this, print it, share it. Perhaps you're a vet dialing in and you would like to share with your clients. It is there and it will be updated constantly. So it's there for you to use. Please use it. But I will refer to Gareth now. Thank you.
Yeah, good afternoon, everybody, and welcome to this webinar, which has got unprecedented interest. Won't hang around with the introduction too long. Got a lot to get through. I'm a vet. I'm on the British Cattle Veterinary Association board. I'm also a member of the UK Livestock Core Group, and I'm also the British Veterinary Association Scottish Branch President. It's great to introduce the speakers who are going to talk to us today. First up will be Christine Middlemiss, who is the UK CVO. She apologises because her camera isn't working, but you'll certainly be able to hear her. Secondly will be Gordon Hickman. Gordon's the head of exotic disease policy in Defra. And we're also joined by Sasha van Helvoort, who's the veterinary head of outbreak delivery at APHA. So without any more ado, if I can head over to Christine and then Gordon to speak. They'll be speaking for about 40 minutes. Then there'll be opportunity for questions. So I'd encourage you to put questions in the question box top right of your screen. Thank you.
Many thanks, Gareth. Hopefully everyone can hear me. Apologies, you can't see me. I had to join on my laptop and the camera's broken. So thank you for joining today. Really welcome the opportunity to talk to everybody about what's going on. We've been preparing for this potential incursion this summer for quite a while. Luckily, the upside of the cold spell that we had is that it has taken some time for levels of disease in the continent to get great enough for a virus to reach us. Next slide, please. A reminder that and the next one. A reminder really about this Bluetongue. So it's Bluetongue 3 that we've confirmed is a new strain to us as of last autumn and a new strain to Europe. It was Bluetongue 8 that we had before in 2007, 2008 when we vaccinated out of it. It remains a notifiable disease in the UK. The situation in the EU is different, but it is notifiable here. So if you suspect disease, there's an obligation to report it. Causes a variety of clinical signs, which can be quite general: reduced milk yield, reproductive performance, abortion, most of the things you see with having a high temperature, but also facial swellings, blisters, ulcering around the mouth, nose, and the coronary band. Doesn't affect people, doesn't affect food safety in any way. And next slide, please. Importantly, it is spread by biting midges. So it doesn't move animal to animal. It requires a midge to bite an infected animal and then move on to a susceptible one and bite that and then create infection spread. And that's why our risk has been from the midges coming in from the continent. But as we get into controls, there are times when it's relevant to manage infected animals, although they won't directly spread infection, to stop midges in new areas becoming infected. And next slide, please. And of course, what's important is that the virus only replicates in midges above a certain temperature, about 12 degrees. Midges are very inactive in cold weather. They can overwinter in little warm pockets and stables and things, but it is really a summer and into autumn disease. Midges are very efficient. So not all midges are infected, and it's near impossible to test midges if they've got infection or not. But when they are infected, it only takes one to bite, and that can create infection in a susceptible animal. Next slide. So as I said, it's not a surprise. I think what was a surprise was that it has taken a while for disease to take off again in the Netherlands and Belgium, and considering the level of disease they had last year, trying for it not to have overwintered in there in some way just didn't seem feasible. As slowly the temperatures have warmed up. A month ago, they had very few cases, a handful, but in the last month, they rapidly went to thousands of cases. We've been watching the weather patterns for wind direction for the blowing of infected midges over to England, depending on where disease is, and understanding where our risk would be. We've slowly gone from very low to low risk of midges being blown over. We were at medium, and now that has increased. Next slide, please. So let's say we've been checking this daily. and have weekly reports which have been shared and updated with the core group about what our risk has been. The little blue triangles there are where we have midge traps. So our risk is a combination of the likelihood of infected midges being blown over and then the likelihood of that infection being sustained in midges in England when the temperature is warm enough. Next slide, please. We did a lot of modelling in the spring to understand what a disease outbreak might look like, and we worked on our reasonable worst case scenario. So it's important to note that is not the likely scenario, it's what it might look like if we had high temperatures early in the year for a sustained period and had early incursion of disease. But regardless of what scenario we took, what the modelling showed us was the earlier the virus came over, the more cases we'd get. September was always like to be the peak of cases, the way that the temperatures and midge infectivity would work. As we put in movement controls, although this is about infected midges, stopping the long-range movement of infected animals does help slow the spread of disease. And we expected, given that based in the Netherlands and what we saw in 2007 in the UK, about a third of farms to have clinical signs. So when we detected Bluetongue 3 in the autumn, it was done purely on surveillance and on blood sampling. All the animals didn't have any clinical signs. This time it's different. We have found clinical signs in animals. Next slide, please. And I'll talk more about those. Now, don't worry about the figures in this. This was purely the modelling. And the one thing about models, whilst they're very helpful, they're never actually right. But the top line showed incursion of infected midges on the 1st of May. The bottom line is 1st of July. And moving from in the left-hand column is no movement restrictions at all. And the far right-hand column is putting in 2 levels of control zones. So the take-home message on this slide is movement restrictions do help stop the spread of disease. Next slide, please. And here's some photos of clinical signs of disease. These photos are from the Netherlands and research studies, but we have gathered together a document of photos from the cases that we have had in England so far this year. And that is being shared with core group and widely and with vets and so on. It's just been put together, so it is on its way around at the moment. So you can actually see the sort of disease picture that we're seeing. But as I said, it's about swollen heads, crusty noses, ulceration along the lips, the coronary band, a variety of different signs that can mimic foot and mouth disease, malignant catarrh in some cases. So our approach when we have a suspect case and we can't clearly rule out disease, which is quite often when you have clinical signs like this, is to sample and take samples, test them at the lab. Not all the suspect cases are Bluetongue or another notifiable disease. Some animals have been had sunburn and so on, can cause similar signs. But if this is what you're seeing, do report it. Next slide, please. Oh yeah, and here's some pictures of cattle that we have seen in the last week or so in the UK. So some of them are quite subtle, but when you take them all together, it adds up to a picture of, okay, we might have disease here, let's phone it in. And indeed, we have found virus in clinically affected animals. And then when we've done further sampling on those premises, also in non-clinically affected animals. Next slide, please. And here's sheep, again, sheep signs for this year. Those, I say, are available, so we can move to the next slide, please. And and there's more yet. Right, so I want to talk about the principles of effective disease control, and then I'll shortly hand over to Gordon, who will take us through where we are now in the situation currently. So we have been undertaking surveillance, the passive surveillance, that obligation to report gave us the heads up that disease was here. There wasn't any point undertaking lots of blood testing to find out if we had got disease without having clinical signs, because you could never sample all the animals that were at risk frequently enough to be able to pick it up early enough. Because the result is only as good as the sample on that day. If the midge bites and infects the next day, you will have missed it. So passive surveillance has been the main proponent. It's very difficult to manage the vectors. So insecticides on individual animals can have benefits. Insecticides in vehicles can have benefits, but realistically, you're not going to stop all the infected midges. We have culled the very initial animals we found. And that's because if you think you only have one animal in a premise, or you don't know how your outbreak is going to pan out, it is worth trying to reduce the level of virus on that premises. And so we culled 4 animals last week, but now we have evidence of very localized circulation. So in our own midges, because it looks like it has been spread from animal to animal on farm, which was unlikely to have been all the animals that we found positive that were bitten by midges that blew over. There is no value in ongoing culling. It may be if we get a jump of virus into the disease-free area, into a clean area, and we think that's the first animal there, again, we may opt to cull it. But once you have localized and spread in an area, culling is of no benefit. I talked about movement controls. They are effective and stop for long distance movements in taking disease to free parts of the country and infecting midges there. And then that therefore is the basis of the restriction areas that we have put in. But we do appreciate they are a massive burden on industry, and we're very much, who are in the zone, and we're very much trying to walk a line between having restrictions in place that stop the spread of disease to the free area, whilst not for those within the restricted area being so burdensome that they cannot undertake any activity at all. Vaccine, we'll come on to vaccine because our situation has been progressing rapidly on that. There is vaccines for other strains of Bluetongue. They aren't effective against Bluetongue 3. 3 manufacturers have developed a vaccine. You'll be aware it has been used on the continent. We have slides later on in this presentation where we will talk more about what our vaccination situation is specifically. Next slide, please. So Gordon's appeared. So this is where I'm going to hand over to Gordon, who's going to give you an update on that current situation and disease controls. Thanks, Gordon.
So good afternoon, everyone, and thanks for welcoming me back. Great to see so many people online. What I'm going to do is just very quickly go through how the outbreak or the situation has evolved, just to paint a picture as to where we've got to, very quickly talk about the current position, and then I think talk about the current controls, what you can and can't do, and a little bit about the vaccine. So Bank Holiday Monday, 26th of August, we got the bad news that following a report of suspicion in a ram on a small mixed farm, we confirmed Bluetongue 3. You'll be aware that we previously shared and discussed our disease control framework for England in 2024. So we immediately put in place a temporary control zone of 20 kilometers, and that map on the right hand side is what that looked like. As it happened, another ram on the same farm showed clinical signs a couple of days later, and that was also tested. As Christine said, those animals were culled because we didn't know where we were at in terms of the phase of the outbreak, and we moved forward. The EPI assessment of those animals based on the PCR results and the ELISA results and what we knew about the situation at the time suggested the most likely date of infection was around about the 11th of August. So just remember that date as we go forward. Next slide, please. So we then continued to get one or two more reports of disease, and 2 new cases very close to we'll call it the index case, were confirmed positive over the next couple of days. And once that was confirmed, we extended the temporary control zone, again in keeping with our policy, and that map on the right is what the TCZ looked like. We then did some surveillance on that individual premises and tested some other animals on that farm, and that, together with the other results from those other 2 affected premises, gave us strong evidence that there was local transmission ongoing, or good evidence of transmission. Not saying that we had widespread circulation throughout the whole of England or anything, but there was clearly local spread, local transmission through our own midge population. So that immediately kicked us into the next phase or stage of our response plan. Circulating disease. So we decided how big an area to put in place. We discussed it with core group and decided that the best thing to do would be to put in place a single restricted zone covering Norfolk and Suffolk, and we put that in place on the 30th of August. Next slide, please. We continued to get more report cases, more suspicion, and cases on farms. We started to detect them down through Suffolk. So working with colleagues in the Met Office and Pirbright, we looked in more detail in and around the 11th of August, and those maps there are produced by the Met Office through their name model. And remember, these are just indications. Don't imagine that there's a whole plume of sort of midges on a wind coming towards us. There will be midges carried on the wind in that sort of broad area. Some of them will be infected, some of them won't be infected, some of them will be developing infection. And when we looked at the different sources, and the sources are in continental Europe, where they're modelled from, it became pretty clear. If you look at source 5, where in the Netherlands we knew that there was disease, it mirrored what we were seeing. So North Norfolk down through Suffolk, but importantly into Essex. And then if you look at source 4, although there wasn't much disease there, there was more evidence that those sort of plumes on and around that time were certainly going into Essex. Please don't think that those plumes continue over land. Behaviour is very different when it goes over land. So we just look at it as a way of estimating where we might need to look more closely. Next slide, please. Sorry, as a result of that, we decided to extend the zone to cover the whole of Essex as well. So where are we as of now? So first case confirmed on the 26th of August. They are all Bluetongue 3. We've confirmed disease on 15 premises. They're all in Norfolk and Suffolk at the moment. We've had 1 or 2 cases outside, report cases. So far they've been negative, thankfully. The RZ, the restricted zone, covers Norfolk, Suffolk and Essex, and all of them, bar 1, have been detected through passive surveillance. That surveillance, as Christine said, so all these animals have shown clinical signs of disease. APHA has gone out, tested, and they've come back positive. 1 was found in some limited surveillance that we did very early on around the premises, just to establish whether disease was circulating or not. That's the 1 outlier. So we've now got movement controls that apply to all ruminants and all camelids and to their germinal products if you're in the zone. So if you're in that RZ, or you're placed under restriction because of a tracing or for some other reason. If you're placed under Bluetongue restrictions, those animals are placed under restriction. We will, as Christine alluded to, shortly be issuing a licence that will allow keepers in those high-risk counties of England to vaccinate susceptible stock with an unauthorised vaccine, but which has been permitted for use by the Secretary of State for use under licence, and we'll talk more about that. So that's basically the current disease situation. Next slide, please. So what can you and can't you do? Obviously it's quite difficult to put all of this on gov.uk. We do our best, but I'll try and talk you through what you can and can't do. So that's what the zone looks like. You can look on the interactive map, so it's easily attainable on gov.uk. You can zoom right in to see whether you're in or out of the zone, but basically, if your premises is in Norfolk, Suffolk or Essex, you're in the zone. Next slide, please. So if you're in the zone, you don't need a license to move to a slaughterhouse, provided that slaughterhouse is within the restricted zone. And that slaughterhouse taking those animals from a restricted zone does not need to be designated. So that's the easy bit. So abattoirs in the zone can be sent to that abattoir without the need of a license. Other movements do need a license. So movements of susceptible animals to live into or within the restricted zone do not need a license. So as long as you're moving within the zone, you don't need a license. Shows and gatherings are allowed in that restricted zone, but remember, any animals attending that show or gathering cannot leave the zone. So they can move into the zone, but they can't move out again. So if you're a show organizer or you are thinking of sending animals to a show in that or market in that zone, they can't come out again without pre-movement testing. Importantly, you cannot move animals within that zone if they're showing any clinical signs indicative of Bluetongue on the day of transport. So that's prohibited under the legislation. You wouldn't want to do it anyway, but please don't do it. And germinal products, if you want to freeze germinal products in the zone, you need to get a specific license. And if you operate a germinal products collection centre in those zones, you can apply to be designated, because that gives you a lot more freedom. And you can move germinal products within that zone. So that's within the zone, and we've tried to do what we can to minimise the impact on keepers within the zone. So if you're in the zone and you want to move out of the zone, what can you do? So if you want to move to slaughter, you can do so. There is a general license to move animals direct to a designated slaughterhouse outside of the zone in England or Wales, provided they're going to be slaughtered immediately. And that means between an hour after sunrise and 2 hours after sunset. That's prevented. Conditions apply, and they're set out in the license. If you want to do that, there's no pre-movement testing. Make sure those animals are not showing any clinical signs. Download a copy of the general license from gov.uk and give it to the transporter, because that's evidence that he's travelling in compliance with that general license. It, however, doesn't apply if you've been placed under Bluetongue restriction notice. And that could be because you're an infected place, you're an infected premises, you've got confirmed positive animals, or you've been placed under restriction because you've got suspicion of disease there, or for some reason you're a tracing or anything else like that. In those cases, you can still apply for a specific license for that move, but that general license doesn't apply. If you want to know where designated abattoirs are, slaughterhouses, there's 29 or 30 of them. Look on gov.uk, there's a full list there. And there's more coming online as we speak. But check first that your chosen abattoir is on that list. For other movements, for all other animal movements, including movements to live outside that restricted zone, you must apply for a specific license. You can't take advantage of a general license, so you must apply to APHA through their portal for that license. So at this time, you cannot move animals to a market outside of the zone, and you cannot move animals purchased at a market inside of the zone to a destination outside of the zone. Now, we know that you'd like to do that. We just haven't got to that place yet. There's some, it's a higher risk, and it's much harder to manage that through a market. But if you want to animals move to live premises to premises, you can apply for a zone now, for a license now. The condition of that movement will be that you need a pre-movement test for every animal. That animal, when it gets to the destination premises, will be placed under restriction and will be subject to a post-movement test. Government will pay for that test. If you want to move germinal products from susceptible animals out of the zone, again, you must obtain a specific license. If you operate a germinal product collection centre, you can apply to be designated. Next slide, please. So I think I probably said this already about a general license. So that applies to the movement of susceptible animals or their germinal products, which would otherwise be prohibited. You need to read that general license. It's not just free movement. You've got to follow the conditions of that. Please check it carefully because they do change from time to time, and we would urge you to download the latest version of that and give it, as I said, to the transporter. I think I've covered that. Next slide, please. Again, because there is, we get asked what's the difference between a specific license and a general license. So if a general license isn't available, you can apply to APHA where there is a license available through their licensing portal. You can either screen save this. It's very easy to get off gov.uk, and that link should work hopefully when you obtain the recording afterwards. You should apply as soon as possible. You need at least 5 days for your license to be processed where possible. Clearly we'll try and do things more quickly than that, but the more complex or the higher the risk movement, it will take longer to process because each one will need an individual risk assessment or an assessment by a licensing vet. So I guess one of the take-home messages, make sure that you've got contingency plans, apply in good time, think what steps would happen if that license is refused for one reason or another. Once issued, it'll allow a one-off movement subject to the conditions based in that license, and obviously based on that disease control risk. Please take precautions when moving animals. Check them for signs of disease. Most of those licenses will require you to spray the inside of the vehicle with an insecticide approved against flying insects before loading. Make sure that that product is dried, particularly if they're going to slaughter, because obviously we don't want you to fall foul of any withdrawal periods or anything else like that. And if you're in a zone, even if you don't need a license, please only move them when it's absolutely necessary. Ideally we wouldn't want animals to be moved from high risk areas within that zone to close to the border, but that's your call. please only move them if necessary. And I think I've covered for suspect and contact premises, you'll need a specific license. So that's all I was going to say about licenses and what you can and can't do. Just a reminder that we're still offering free testing. That's most relevant now to Kent and East Sussex, for where you're moving those animals to live outside of those areas. So again, they're not in a zone, but we would urge you to do that free movement testing, because you saw those plumes. Those counties are at some risk. We haven't yet found any disease there. And again, we've spoken about this before. You can get it, email admin at UK Farm Care, or there's a telephone number there. Next slide, please. Few other things that come up. So what about if a bit of my premise is within the zone and a bit of it's out? Well, any premises that has any land within the restricted zone or that straddled the boundary are classified as being within the zone. So if any part of your CPH is in the zone, you're in the zone. If part of your premises is in the zone and you've got part of your CPH that is totally discrete and away from the zone, you'll still need to apply for a license, and we may or may not consider that depending on the circumstances. What animals do these apply to? I think I covered that. Well, it's all ruminants, so cattle, sheep, goats, deer, and other ruminants, bison and other things like that, and all camelids, camels, llamas and alpacas, etc. All other animals, pigs and poultry, horses, etc., they're free to move as normal. They're not caught up by these restrictions. And just a reminder, what's a germinal product? So that's embryo, ova, an ovum, or semen of any of those susceptible animals. Next slide, please. Ooh, free testing again. Vaccination. So we said at the beginning, there are no authorised vaccines. That's still the case. There are no authorised vaccines in the UK or Europe for that matter. There are three types of ways that vaccines can be allowed to be used. You can have a full marketing authorisation. That's the types of things that most vaccines now have a full marketing authorisation. That can take a long time to go through the process and a lot of evidence base. You can have a provisional marketing authorisation. That's where you've got good sets of evidence, but perhaps not got the full suite of evidence base, and that can be more quickly obtained. That is our preferred type of approach, those two, either full or provisional marketing authorisation. Or we can permit the use under emergency use, for want of a better word. You might hear it called Schedule 4. And so under that, the Secretary of State can allow or permit the use of an unauthorised vaccine in an emergency situation. And those emergency situations are where you've got an epizootic disease, an exotic disease of importance, if you like. I'm pleased to say that as of this morning, the Secretary of State has now permitted the use of 3 unauthorised vaccines. I'll show you the website link in a minute. So that means that they could be made available for sale in the UK. That doesn't mean to say that they can be used. There needs to be a separate license to allow vaccines to be used. And our ministers in England have agreed to us to allow on a phased rollout the licensing of those 3 vaccines in England, starting in the high risk areas. Next slide, please. So if you want to know which ones they are, go on to that website link, or just search BTV3 vaccine permits. The 3 permits are now on the website, and there's a little bit of narrative around there. But I think what we want to stress to you is that perhaps unlike the other Bluetongue vaccines that we experienced back in 2007-8, and that are widely used in continental Europe, these vaccines tend to be, we've called them suppressive. They're certainly not preventive, and you'll be aware from Dutch colleagues that despite having vaccinated 90% of their sheep, they were still getting significant, and still are getting significant, clinical disease. So these vaccines do not mean that they'll prevent your animals from getting infected, and it doesn't, and they will still, if they get infected, they're still likely to be infectious and so can spread disease. There's good evidence that they reduce the clinical signs experienced, and evidence that the mortality rates are reduced. But because these animals, even when vaccinated, even when they've gone through their full course of vaccine, some of them require 1 dose, typically for sheep. Cattle, I think, all need 2 doses, and you'll need to look at the product characteristics to decide what those are. We cannot guarantee that those animals are preventive, protected, and so even if you vaccinate them, we'll still treat them as unvaccinated for the purposes of disease control. So trade restrictions and movement controls will still apply. So if you're interested in this and you're in a high-risk area, and those high-risk areas are Norfolk, Suffolk, Essex, Kent and East Sussex, there will be a general licence coming back end of the week, I would think, possibly into the weekend. So start talking to your private vet now to see whether it's for you. Noting what I've just said above. It'll need a written prescription from your vet, and that vaccine will need to be supplied by that vet. Clearly the vaccines will be in the wholesale market, but we're looking for vets to be the suppliers. We will, however, allow it to be administered by a farmer or the animal keeper, provided provided the medicine record is maintained and made available for inspection. Any animals vaccinated must be permanently marked with an official ID, and obviously that individual ID needs to be recorded in that medicine book. And we're going to ask the prescribing vet to let us know the number of doses prescribed and the number of farms prescribed on a weekly basis. That's just to monitor uptake. We're also going to, at the same time, make available the option of applying for a specific license if you're outside of those high-risk counties, but in England, where you think that there is a real benefit to your business from being licensed to vaccinate. That might be, you've got high-yielding dairy cows. It might mean you've got breeds at risk. There might be a number of other reasons, and those things will be considered. The reason why we've focused on those high-risk counties is that we don't know, what demand's going to be. We've got a feel for supply, but it really depends on uptake in continental Europe as well. And we want to make sure that those at greatest risk, at greatest need, get first dibs at that vaccine. If the take-up's low and we've got loads of supply, we'll open up that general license, probably along the south coast next, and then make it available for the rest of England. Remember, that's England only. Colleagues in Scotland, Wales and Northern Ireland will make their own separate decisions, and we'll talk to you about that separately. So this is, I think, my last slide before Q&A. Really, our call to action is please be vigilant, monitor your livestock for clinical signs of bluetongue. It is notifiable, as Christine said, so let us know of suspect disease. It's important that we know, because our policy is about containment, managing risk where we can, so minimizing the impact on keepers in those zones, but we want to make sure that disease is contained where we've got disease. We don't want animals moving through the rest of the UK, also the rest of GB, and creating a risk. Be prepared. If you're outside of the zone, just think what would happen if you're in a zone. We are getting reports outside of those areas. Any one of those could be positive. Register your land, including temporary Lexic buildings, etc. Sign up for those disease alerts that were flagged at the beginning, and source responsibly. If you're buying, perhaps ask for, out of those higher risk areas, ask for a free movement test. Next slide, please. I think that's it. So I'm sure there'll be some questions, and we've got Christine, Sasha, and myself to try and answer them.
Yeah, thanks. Thanks, Gordon and Christine. Sasha, you had some slides. Did you want to do those now? You're on mute.
Sorry. Yeah. Sorry, I couldn't access it. Yeah. I'll show some slides before we go on to questions. Let me see if I can share.
While you're swapping over, there was one question about what did RWCS stand for. I can answer that one. That was in Christine's part. That's reasonable worst case scenario, which is in effect what would you reasonably expect to be the worst case. So that's what that stands for. Quick question for Gordon. Who will perform the pre and post movement testing?
So that'll be likely to be a veterinary delivery partner vet, the same vets that are doing the free testing. It's possible that it could be an APHA vet if they happen to be in the area. Yeah, so it'll have to be under contract to APHA. We would allow your own private vet or private vets to take those samples, provided that they sign the appropriate attestation, but we won't fund the sampling cost for that. We'll only fund the diagnostic costs.
Okay, thank you for that. So Sasha, would you like to just give you a few slides and then we'll move on to questions? Thanks.
Yeah, so you can see them, can you?
Yep. Yes.
Oh, good. Thank you. Right. Sorry, just need to. So I just wanted, I know Christine showed signs, but I thought it would be good to remind everyone, so when they're out on farm, they can look for various things. These are the clinical signs that we heard from Holland. So for starting with cattle, they were off, even in Holland, they were often subclinical. You could get fever, the animals would be depressed, they'd have a reduced milk yield. Some would have a poor fertility. There'd be lameness, mouth and muzzle lesions, crusting of the muzzles, oral ulceration, also abortion, amongst others. Now, what we've seen here at present in this past week, we haven't had that many cases of cattle, but we have seen some clinical signs. Most of them, we haven't seen anything. What's been noticed is that they have been painful on their feet and want to lie down more than not. They've shown red nose or reddening of around the nostrils. There's also been a slight ulceration or crusting, could be in liaison to a bit more of a dirty nose, and some eye tearing as well as crusting around the eye. Also, what we've seen, interestingly, is lesions on the teats. Now, all very difficult to see if you've got a field full of cattle, but hopefully if you happen to be able to look closely. So Christine shared these slides as well, and you can see from the top left photo there the redness, so it's not very clear. On the other hand, if you see the right one, that's quite obvious. You can see definite ulcers there and real crusting around. And then the teat lesions, and then there again you can see these little red reddening of the teats. Not as such much ulcer there, but definitely colouring there. Then for clinical signs of sheep, and this is again the Dutch signs, so you'd have fever, depression, nasal discharge, a lot of crusting, conjunctivitis, also swelling of the facial area, and bleeding of lips, ulceration, hypersalivation, lameness, there they also saw lesions around the knees and hooves. Now this was seen in latter stages, so with secondary infections, so animals that had gotten better and a bit later they'd then show these things. Our sheep are present. What we've seen mainly is what they've noticed initially is that the animal's depressed, it's not eating. They're often lying down or flat out. They do show fever, so they've got a high temperature. They can be lame. Sometimes they're sort of standing there with their stomach up in the air, so as if like they're walking on the tips of their toes, and not necessarily lameness as such. They are salivating. You've got crusting around the nose. You've got also nasal discharge. This can be clear discharge, but it can also be purulent, so pus in there. They've also shown ulcers of the mouth. We've seen bleeding of the lips. There has been swelling seen, but it's not very obvious. So yeah, it's difficult to see, and it's often gone before you know it. And they have also shown respiratory distress. And if we see the pictures here, there you can see the sheep lying down. On the right picture, there's the bleeding in the corner of the mouth there, and that's for Bluetongue. The virus attacks the lining of the blood vessels, so you can see bleeding. The other ones are ulceration of the mouth and of the gums, which you can often see that on the dental plate inside the mouth. So just signs that we have now picked up at this point, and we'll be seeing others, I'm sure, as we go along. And here again, you can see the discharge out of the nose on the left one, and again the redness of the muzzle on the top right there. So when you see clinical signs, please report it to us immediately. Please do treat any of the cases you have. If you see one, please alleviate the pain and distress immediately. We have noticed that, or it's been told to us, the anti-inflammatories that have been used, and this has also been seen in Holland, really do alleviate the clinical signs. So make sure you do treat your animals. There's nothing else we can do, but we can help with the pain. Then also, please do call your private vet, should that be required, to be able to get medication, and also if you're not too sure about things. Restrictions that are placed on the farms, they only apply to the live susceptible animals, so you can have your vet come on site. The vet can attend and leave the premises, but obviously if they think there's something else than Bluetongue, that another notifiable disease is possible, then obviously things change slightly. So also we have seen that some of the animals that have gone down with these signs are getting better again, but equally some of them get sick again after that. So again, if you've had a positive case on your farm, do please continue to tell us if you've got further clinical cases. For our surveillance, we are undertaking surveillance at the minute within the restricted zone, but only those premises that are selected for surveillance will be contacted. So it's not like the previous year where we contacted everyone within the temporary control zone. So now it's just if you are selected, we will call you. And I just wanted to mention what you expect when we come to your farm. Is that a certain amount of animals will be selected to be sampled, so it'll be cattle. And all susceptible animals on the farm will be inspected, so that would include sheep or goats or whatever you have on farm. We also strongly encourage, like Gordon said earlier, to register if you've got any temporary land or buildings, and there's a link there to find out about how and what to do. Then also to mention the licensing service, that's the portal that we have at Animal Plant Health Agency. Obviously Gordon went through all the licenses that are there, but please do check the site to find out which licenses are available and how to apply. And last but not least, if you have a case, please call us. Thanks.
Great, thank you very much, all three of you. Lots of questions flying in. I think the first one will be, what can we be doing to protect our animals? Are there any products we can treat animals with to prevent bites? And along that, is there any evidence that insect repellent, pour-on or sheep dipping could reduce that?
So I think I'll jump in there. It's been shown in Holland that treating with products doesn't change much. Even so, I think definitely on cases where there's active disease, it does help, because when the midge bites, then at least the midge dies. But to prevent disease, it doesn't help as such. On the other hand, it has been shown in Holland that if you house animals, they're less prone to being bitten. So it would be an idea on times of during high activity, midge activity, so that's in dawn and dusk. If you can, it's often not possible that you house the animals at that point in time.
Yeah, we can probably, there is a good paper, I think, that sets by Raw GD that has looked at some based on questionnaires, and there is, as Sasha said, there is definitely some positive effect or in reducing from housing, even more if you can add ventilation. That's positive ventilation. That's not possible in most cases, and even more if you can put vector screens on. I think there's a negative correlation between shearing and disease. So, if you shear, there's more likelihood of those animals going down at around the time of shearing. But as Sasha says, there is no evidence that insecticides prevent infection or prevent them. But what we do is we require the vehicles to be treated, because whilst you can't long-term protect that animal if it's continually exposed, if you've got a small group of animals moving somewhere, then you can just protect for that period of time that you're hitchhikers or anything else like that to move out of the zone. So that's why we require it on the infrastructure, either the vehicle.
Okay, and an allied question is, what advice can you give about the type of insecticide that could be used?
So I believe that all insecticides, on sale have to be approved as a biocide. So look for those that are effective against flying insects, and if you can get a flying insect that also protects against a biting insect, that's good. There's a couple of the active ingredient, there's some commonality of that, but yeah, it's flying, biting insects.
Just be aware of the withdrawal period. There are long withdrawal periods on these products, so take care there.
Yeah, thank you. A number of questions relate to the effect on farms. So what is the exit strategy for farms in the RZ that are currently under standstill, by which I presume they mean is they've got infection? Farmers are becoming very distressed about the lack of communication, and quite a lot of farmers will be sending livestock off to markets outside of the RZs. So it's the exit strategy question, really, I think.
Yeah. I mean, that's still under review because we still don't quite know what's going on in terms of those premises. But if you want to sell animals off that premises, apply for a license. You know, we're not banging those farms up. We just want to manage the increased risk from those premises. So as long as they're not showing clinical signs, we will license them out of the zone, even if it's on an infected premises. There are some restrictions in terms of time from the time that you became infected, typically 30 days, but we can look at that on a case-by-case basis.
Okay, thank you. Moving on to vaccines, any idea about when vaccines might be available in the field?
So I think it's still early days. We obviously have communicated that to the 3 vaccine manufacturers. They are pleased and are looking to facilitate that. I think we probably need to come back to you. I want to manage expectations, you know, but it'll be a couple of weeks at least, I think, before those. I mean, we've obviously got to issue the license so that you can see that. But it's not too early to start talking to your private vet if that's what you're interested in. We can't call them SPCs, but the product information that supports those products is available. I think it's now online. It will be online very soon. So have a look at those product characteristics, because you need to look at the number of doses. You need to look at, some of them can't be used on rams, for example. Some of them can't be used on young animals. So you need to work out whether it's right for you in the first place. And then you'll be in a good place for when it does become available through the normal wholesale channels through your private vet.
Okay. Will farmers in the at-risk area need to pay for the vaccine, or is there any government subsidy? And will the price vary by vet?
I can't comment on the price by vet. It'll be through the normal commercial channels, and no, government is not intending to subsidise the use anywhere.
Okay. Is there any risk of spread through needle sharing when vaccinating herds or flocks? And I think by needle sharing, that's within the herd or flock rather than between farms.
Yes, we've really got to be careful. It can be spread blood-wise. I mean, that's how the midges, they suck blood, and that's how they get the disease. But needles as well, you've got to be very careful. So it's 1 needle per animal. So and it's the same for if people do foot trimming, they need to minimize that as well. Clean everything.
Yeah, thank you. And I should just remind people we're running over. Our speakers can carry on for a little bit longer, and given that there's a number of questions still, assuming everybody's happy to carry on, we'll keep going for 5 minutes or so longer if that's okay. If animals are vaccinated, does this affect the testing results?
So these vaccines are not properly DEVA, if you put it that way. Yeah. We will be testing by PCR, and it shouldn't affect that result. It's possible that there could be a transient sort of increase in signal, but we would just go back and retest if we knew it was a vaccinated animal. So no, I think is the answer to that. But clearly,
I would be a bit slightly more cautious. So we think for a few days, as Gordon says, there may be a period a few days after vaccination where if you sampled, you might get a very mild viremia, virus in the blood, and not yet have antibodies developed, and we couldn't walk away from that as being definitely not infected, so we would retest. So it will be a very few animals, but it's not a blanket. No, you can't, and every single animal distinguish infection from vaccination.
Thanks. What about species such as camelids, not cattle and sheep, and use of vaccine in those?
I think you need to talk to your private vet and look at the product characteristics. They haven't been tested on those products, but you need to look at the individual situation.
So we're not making a they'll be available, as Gordon said, in the high risk area, in the restricted areas where the first phase of vaccine will be availability will be focused, and then it will be for that decision in discussion with your private vet, whether you're a cattle or sheep owner or a camelid owner, about whether you should use them or not.
Thanks. Question for Sasha. Is lameness or coronary band lesions always a feature?
Sadly, nothing is always a feature. It can be one of a multitude of things. We have seen in most cases, I must say, in the ones we've had that have been sensitive to the feet. So, but it doesn't mean that it's always there, sadly.
Thanks. And one for Christine, I guess. Are there any timescales for livestock to be exported to Europe during this outbreak?
No, but so this vaccine, because it doesn't create immunity, means that we can't export with it. It doesn't satisfy the conditions of the export health certificate. So we're really looking to having a fully authorized vaccine or immunity in some other way through infection, really, before and to be able to establish country freedom before we're able to re-export to Europe.
Thanks.
Oh, I should note it's the same the other way around also. So for exports of dairy cattle, say from the Netherlands to us, it's the exact same position.
Another question on vaccine. How long does it take for the vaccine to become effective after it has been administered? And bear in mind, obviously, there's 3.
I think you need to talk to your private vet, look at the product characteristics. They're all slightly different, and some require a booster dose after X period of time. So I think just look at those product characteristics. So because there are 3, you can't generalize, I think.
Are breeding animals allowed to move out of the restriction zone from an infected premise with a license?
We'll consider any of those things. They'll obviously need a pre-movement test. Obviously, if it's a known positive animal, we won't allow it to move, but there will potentially be animals that are not PCR positive on those premises. So we will consider any of those moves.
Thanks.
If it's PCR positive, it won't move.
Yeah. I'm conscious time's getting on, but there've been a number of questions around wild deer. What do we do if wild deer populations are showing clinical signs of BTV?
So I think if you've got very obvious clinical signs, report it through to APHA. We won't come and cull them or anything else like that, but it would be good for us to be aware if there is a clearly animal showing positive signs, and we may or may not take some samples if we find some.
Yeah, so I think that the take-home message there is if seen, report, because it's really important information for outbreak management.
I mean, what APHA can't come and do is go and track them down or whatever. We'll report that and record it, and it'll add to our passive surveillance intelligence. But don't expect us to, unless perhaps there's a carcass, don't expect an APHA vet to come looking, tramping over looking for some wild deer.
Okay, thank you. Just checking through to see if there's anything I haven't. There are quite a few questions that are nuances around the ones that we've covered. I think we've largely covered most of the ones that have been asked. So what we'll, I think, attempt to do is to try and answer any specific ones within that. So from where I'm sitting, I think we're pretty much there. I'd very much like to thank Christine, Gordon, and Sasha for their input. I think as time goes on, there may well be questions that occur to people. Please do keep the questions coming. It's important that we get them and that we are then able to answer them. And I propose that we bring the webinar to a close now. And thank you very much indeed for all of you for your attendance and interest in this.
Thanks, Chair.
Thanks, Gareth.
Thank you.
Anna, if you could just share those housekeeping slides again, please. So just as a reminder to anyone still online, any outstanding questions we've not been able to answer will be answered on the Ruminant Health and Welfare website. You've also got the Bluetongue virus hotline number 024 771 0386. Anna, can you skip through to the support slide, please? We appreciate this is a really difficult time, so there is additional support available. So we'll leave this slide up for about 30 seconds before we draw the webinar to a final close. But please note that support is available and just reach out if you need any help. Thank you. Thank you all for attending.